Welcome back. As we age, our hip joints change. The muscles can become weaker. We can lose flexibility. So today, what happens if you ignore that pain and non-surgical options to treat it? Stacey Roberts is a physical therapist, holistic registered nurse, and the owner of New You Health and Wellness. And Brandy Langbecker is a personal trainer and exercise physiologist there. Good morning, ladies.
Hey,
good morning.
Good morning.
Great to see you both. Stacey, let's start with you. What happens to our hip joint?
Geez, it's like any other joint in the body because it's a ball and socket joint. You can see back here on the model that it's kind of like our shoulder joint, right? So it's a lot of wear and tear that goes on in those ball and socket joints, and especially because we're weight bearing when we're walking, it just takes a lot more excessive stress in that joint. So it can develop arthritis, you can develop labral tears, you can develop a lot of capsular tightness, like we'll talk about what Brandy had and the pain that she was going through over time. And then it hurts, so you don't move it, and then the problem gets worse and worse.
Yeah, and if we ignore it, it just gets worse, like you said.
Exactly, 100%. And sometimes pain in the hip can be coming from the back too, so that complicates things as well. Yeah.
Brandy, what was the situation with you? Because I know that you like to work out. You're a personal trainer, you're an exercise physiologist, I know you're a big runner. What were you noticing that was a problem?
So it started with just when I was running, I had a little bit of a change in my gait. So I would feel a little bit more pressure in my right hip. And then it started to move over into my left knee. And then I would try to walk it out, thinking like, oh, it's just because I'm tired today or whatever excuse we give ourselves, right? And then one day I kind of pushed through the run because that's what we do as athletes, right? We just push through. And then when I got off the treadmill, the rest of the day, I had extreme pain inside my left hip and on the outside of my right hip. So every time I took a step, it was like this knife pain just going right into my hip joints.
Did you ever try standard physical therapy, manually having someone maybe manipulate the joint?
Sure, I do that myself every day when I stretch. But the stretching alone wasn't helping. Like I wasn't getting any relief from it. So like the foam rolling techniques and just the static stretching wasn't producing any kind of results.
And maybe can make it even worse sometimes, I would think. So what made you finally decide to seek help or talk to Stacey about it? Because I heard you were suffering for a while before you mentioned anything.
Yeah, I think she saw me walking down the hall. She's like, Brandy, what's wrong? I said, well, I got this kind of hip pain that's going on. She's like, come here.
So what kind of treatment did you consider for her, Stacey?
So we wanted to, when I did the assessment for her hip, we do a full evaluation and assessment always, and then we wanted to find out what structures were involved. And for Brandy in particular, there's like a balloon around the joint called the capsule. And that capsule, when we have pain and we don't use it as much, that capsule can shrink. So hers was shrinking and her range of motion was 50 to 75% less than on the other side. So what we had to figure out is where that was coming from and why she was having that issue. So we looked at Softwave as the treatment, and as you know, that brings more blood flow to the area, helps to loosen up that capsule, which is a very, very difficult structure to stretch. And once we get more blood flow to that capsule, I was able to do some stretching, like you've done for your shoulder, Molly. And then after the stretching, now we're doing more strengthening and stabilization. We're actually working on her low back as well to increase the range of motion in her hip.
We're looking at Softwave there. It looks like it's on someone's knee, but the same principle applies to the shoulder, like for me, my ankle and my shoulder. But this is something that I would say is not necessarily pain-free, because when you get close to those joints, it can kind of hurt a little bit. But really, compared to a lot of things, it is virtually painless. And it's that stimulation of the blood to that joint that really helps to repair it, right? Non-surgically.
Absolutely. So sometimes when you bring blood flow to a joint, it can actually increase the inflammation temporarily. But the nice thing about Softwave is we're moving it from more pro-inflammatory state into an anti-inflammatory state to allow the body to heal, because that's the normal process of healing. So Softwave is really unique in that as well too. And come on, Molly, it doesn't really hurt. It's just a little bit uncomfortable.
It doesn't. I just want to make sure people know it's slightly uncomfortable, but really compared to even a lot of other things I've done, it's nothing. But when you look at it, it looks like almost like a little ultrasound device. It seems hard to believe that doing that over a joint is actually going to lead to less pain and recovery in the joint.
Yeah, and the nice thing about it too is because it gets so deep into the joint, we use it as a diagnostic slash biofeedback mechanism. So, like for example, if I'm working on the hip, but the person's not getting better, then I can go over the back and see if there's any issues in the back that it picks up. So that we'll be able to then focus on the back as well too. So it really helps us decide where to treat and what to treat as well.
We ran out of time, Brandy, but I know you had one treatment, you were significantly better, and it did take a few more follow-up treatments. In a word or two, how are you feeling now?
I'm back to my old running gaits. I have no pain when I run. I don't limp after I run. So, and my flexibility is coming back too. So, and that's been the greatest thing that I've seen.
Good for you. Great talking to you, ladies. Thank you so much.
Thank you, Molly.
Welcome.
See ya.
Right now, New You Health and Wellness has this special offer for Morning Blend viewers. It is a $47 trial to see if this type of software treatment is right for you. You can give them a call. Here's the phone number. It's 414-299-8121. Or for more information, visit their website. It's newyouhealthandwellness.com.